Hi, I'm Felicity, and I am a psychological wellbeing practitioner, or PWP. As part of my PWP role, I'm also a young people's mental health champion.
Hiya, I'm Kiran. I'm also a psychological wellbeing practitioner. And again, similar to Felicity, as part of this role, I'm a young people's mental health champion.
So, just to tell you a little bit about what champions are, in our service, Swindon Talking Therapies, we have lots of different champions for different groups of people. Champions take responsibility for things like exploring, researching, and developing resources for that group of people. So, for young people in our case. And then we share the resources and information with the rest of the team. We're definitely not experts, but we're really, really passionate about our champion areas. And being a champion allows us to explore our individual interests within this role.
It is vital to have young people champions, as we can often see clients aged from 16 plus in our services. And we know from a recent NHS survey that now 1 in 5 young people aged between 8 to 25 experience mental health difficulties. And we know this has increased from previous years. So our aim is to specifically target the younger population and increase their access to psychological interventions.
So, now a little bit about what we've done and what we're sort of planning to do. So, in the last sort of year or so in our champion roles, we focused on a few different areas. One of these areas was doing outreach and engagement with local sixth forms to encourage young people to get in touch with our service. We've reached out to a few local schools, we've attended assemblies and PSHE sessions to raise awareness of our service and explain what we do and what to expect from appointments with us. We've received really positive feedback from the schools, and we've been invited back to do future talks and attend wellbeing events with other local young people's services. Our plan for the future is to continue to reach out to schools, keep up these relationships that we've built, and make sure that staff and students are aware of our service.
We've also liaised with CAMS, so that's the Child and Adolescent Mental Health Services, to discuss how their service works and what specific support they provide young people. So just being aware of this has been quite helpful, particularly on assessments, when we're signposting young people to services that are more suitable to their needs. We also linked up with CAMS to discuss their confidentiality policy for working with under 18s, which we were then able to incorporate ourselves into our own service by developing a formal confidentiality protocol to ensure the safety of young people, which has now been shared across the BSW Talking Therapies services for use when working with under 18 clients. The aim for the future as young people champions is to maintain and build upon these links with other mental health services so that we can continue to tailor our service to this younger population's needs.
We've also spent lots of time gathering resources for when we work with young people. So we've looked at adapted treatment manuals, specific websites and apps which provide support for young people. And this support's really specific and tailored towards those young people's needs. We've developed a folder with all these resources in so that all practitioners across our services can use these resources. We're planning to kind of keep up to date with any new resources that come out, any apps that are developed specifically for young people, and keep adding these to our resource folder.
This year, we were both able to deliver some in-house team training on working with young people in our service. This is a great opportunity for us to disseminate to the rest of the team the knowledge we had acquired over the last year from liaising with these services, these schools, and of course from the research literature on young people. This included topics such as how to engage young people in therapy, the considerations or adaptations for assessing and treating young people, and also discussing other services available in our area to the younger population that we can signpost to, dependent on their needs, really. The plan is to continue this work to enhance our knowledge and understanding of how younger people can get the most out of psychological therapy, and we'll continue to deliver team training on this in the future.
What we'd really like to know from any young people or parents or carers of young people, what we'd really like to know is what's the best way to pass information on to young people about our service. So currently we use Facebook and we do have a website and we do go to schools, as I've explained earlier. But what we're really keen to know is how we can get the word out about talking therapies. We're really passionate about working with young people. We want to be able to provide them with skills to manage their mental health now and in the future. And we want to know how they can find out that we exist. So if you do have any information, do get in touch with us and let us know sort of what's the best way to reach out to young people.